Okay, so next we'll see why one of the reason why some fractures heal fast while others heal slow. So this is there is a concept of the compressive side versus the tensile side. Okay, compressive side of a fracture versus the tensile side. What is this? Let's see what this is. Okay, we'll uh, two two common sides where fracture happen commonly is the femur as well as the tibia. So let's first see what happens in a femur, the neck of femur. Okay, so let's draw femur. Yeah, it's not that wasn't good. Yeah, not like this. Okay, so this is the femoral neck and the femoral head. Okay, so in a fracture, suppose usually when the fracture happens, the axial loading is along this direction. Okay, so in a fracture, it appears over here. There's a fracture here, and there is a fracture here. Okay, this is along the medial side. This is the compressive side, and this is the tensile side. This is medial, and this is the lateral. Okay, so the fracture in these two locations have very different significance. So the fracture on the compressive side, what happens is when the load goes along this direction, the medial aspect of the compressive side, it's pushed together. So this is the compressive side. So here on the lateral aspect, what happens is the opposite of that. This part is pulled apart. So this is the tensile side. C is for compressive and T is for tensile. Okay. So what happens is whichever fracture that appears in the compressive side fracture heals very well because the bones are pushed together. It heals very well. Whereas the tensile side, the fractures on the tensile side, they don't heal very well. So usually the fracture, that is why the fracture on the lateral aspect of femoral neck is usually a pain in the ass. It does not heal. So this is the reason. And this compressive fracture, that is the fracture on the medial aspect of the femoral neck is more commonly seen in, it is more commonly seen in young people. Whereas this lateral aspect is mostly seen in old people. That is why it's commonly seen the fracture of femoral neck in old age does not heal. That is one of the reasons. Because usually it will be on the lateral aspect and it's on the tensile side. So since the bones are pulled apart, this does not heal very well. Okay. Now let's see what happens with what happens on the tibia. Okay. So the tibia. So suppose this is the tibia, and this is the patella, and the Distal part of femoral condyle comes over here, and the carpal bones are over here. Let's see, suppose that is the calcaneum, monocular, and all those bones. Let's just assume this is a okay. So here what happens is usually the axial load, whether it's compressive load, whether it's the weight bearing load or the load that occurs during a fracture, it is the largest amount of the load goes through the posterior and medial aspect of the tibia. Okay, the posterior and the posteromedial aspect of tibia takes the maximum load. Okay, so what happens is a fracture in this area. Okay, so this when a fracture happens in this area, it usually will be compressive. This will be the compressive side, that is the posteromedial aspect. And opposite to that, this is the tensile side, because this side it's pulled apart. And here on the posteromedial aspect, especially, is the compressive side. Compressive side. And this is the tensile side. This is the anterior tibia. Anterior tibia. So, so obviously, since this is the tensile side, the fractures in the anterior tibia does not heal very well. And since this is the compressive side, that is the posterior medial aspect of tibia is the compressive side, and the fractures here heals very well. Okay. Yeah. So now let's see some interesting facts about some few fractures. One is the calcaneal fracture. Okay. Let's draw a calcaneum. Suppose this is the calcaneal bone. Okay. This is the calcaneal bone. Okay. And rest of the bones, these are rest of the tarsal bones over here. Let's, okay. So this is the calcaneal bone. Mm. So the interesting thing about the fracture of this is the calcaneal fracture. We are talking about the calcaneal fracture. So the interesting thing about calcaneal fracture is calcaneal fracture is the most common fracture of tarsal bone, and 75% of the time these are intra-articular. Okay, 75% of the time these are intra-articular. And these calcaneal fracture, how to identify them is that the calcaneum will have trabecular lines in this orientation. If you check an X-ray image, you'll very easily you can see some lines going in this orientation. These are the trabecular lines, and always calcaneal fracture will be perpendicular to this, like this. Calcaneal fracture will be perpendicular. It could be anywhere on the calcaneum, but always it will be like perpendicular. There is one fracture, there is another fracture, and this will be always perpendicular to the trabecular lines. So if you see some other kind of sclerotic area that is not perpendicular to the trabecular line, mostly it won't be a calcaneal fracture. So that is how you identify a calcaneal fracture. I'll show you some images of some calcaneal fracture. Okay, see some calcaneal fracture X-ray images. Okay, yeah, see, get more images. Okay, some good images I want. There are images, but okay, these are all very subtle. Okay, anyways, I'm looking for something that is more prominently seen. See, at least here you can see the trabecular lines. These are the trabecular lines. Right? Okay, okay. See, these are the trabecular lines. It's very subtle. Maybe the fracture is there, but it's too subtle. Okay, this is a calcaneal stress fracture. Okay, here you can see these are the trabecular lines. If you look carefully, you can see so many trabecular lines are there. And perpendicular to that, you can see a sclerotic area over here. This is a calcaneal fracture. Okay, this will always be in this orientation. I'll show you a few more images. Show you better images. Okay, there's another one. See, the calcaneal stress fracture. Well, calcaneal stress fracture. Okay, this one is better. See, the trabecular lines are in this orientation, and 90 degree to it is the fracture line. The sclerotic area that you are seeing over here is the calcaneal fracture. Okay, and here another one is the calcaneal stress fracture. And this one is quite obvious. And here another one. And this one also is very prominent. Here also another one is there. So the basic thing is that is what you need to remember to identify a calcaneal stress fracture. Okay. Now another interesting fracture is the navicular fracture. Navicular fracture. You need to remember that out of all the tarsal bone, the navicular bone is the most likely bone that can undergo avascular necrosis. Okay. And in the wrist, usually it's the scaphoid and donate. Similar to that, in the tarsal bone in the leg, navicular bone is the one that is commonly undergoes avascular necrosis. And this fracture is very commonly seen in runners. Okay. Almost exclusively seen in runners, like other than trauma. Then another fracture is a march fracture. These are usually seen in military recruits, okay, because of continuous marching. They undergo fracture of metatarsal, metatarsal bone. And the fracture is commonly the classical one is involving the second metatarsal, but it can involve any metatarsal bone. Okay, all that come under the category of March fracture. Okay, so now let's see which fractures heal well without any without any complication, and that too without doing any intervention. Okay, but that is with conservative treatment. Which are the fractures that heals very well? Those are known as the low risk fractures. Okay, those are the low risk fractures, and the fractures which does not heal without any complication with conservative management are the higher risk fractures. Okay, high risk fractures. So let's see which are the low risk and the high risk fractures. So just like what we studied now, if you remember, we we studied two fractures which are high risk, which does not heal. One is the sorry, not the one is the this one, that is the lateral femoral neck fracture. It does not heal because it's on the tensile side. Okay. Then in the tibia, the anterior tibial fracture because it's on the tensile side. Okay. So the first one is lateral iris fracture, lateral femoral neck fracture, lateral femoral neck fracture. And second one is anterior tibial fracture, usually seen in the midshaft. Okay. Then all these fractures are in the lower limb. So the next one is the patella. The patella can undergo both uh, transverse as well as longitudinal fracture. And it's the transverse fracture that is high risk. Transverse patellar fracture is high risk fracture, whereas the longitudinal patellar fracture is low risk. It heals. Okay. Then coming lower down in among the tarsal bones, the first one, the talus fracture is a high risk fracture. Then the navicular fracture because it can undergo avascular necrosis very easily. Navicular fracture is another fracture that is high risk. Whereas in low risk, the tarsal bone, the only one is calcaneal fracture. It's a low risk fracture. And next high risk fracture is among the metatarsal bone. So the interesting thing about high risk fracture among the metatarsal bone is the only the fifth metatarsal bone. The fifth metatarsal fracture is a high risk fracture, whereas the second and third metatarsal fracture can be treated conservatively because it's a low risk fracture. And the last one is a mm, sesamoid bone. Okay, so small bone fracture is iris fracture. Okay, so here the lateral femoral neck and the low risk is medial femoral neck. And anterior tibial fracture, the low risk variety in the tibia is in the posteromedial tibial fracture. So these are the high risk and low risk fractures. So now we know the reason why this high risk and low risk fracture happens in the body. Now, before concluding, I'll just discuss one interesting case. Okay, it's an MRI. It's a clinical. This is an MRI image. Suppose it's a old lady. Okay, an old lady who gets intense pain in the knee. This is a clinical history in the knee when she was getting up from sitting position, getting up from sitting position. Okay, and she came to the uh, uh, hospital and they done an X-ray on her and or an MRI. Okay, and on an MRI, what we see is I'll just tell you the finding. On the MRI, on the medial aspect of the suppose okay, this let's say this is the okay, that's not a good drawing. Mm, yeah, that also is bad. So this is let's imagine this to be the femoral condyle. This is the medial femoral condyle. Okay, this is the medial femoral condyle, and this is the lateral femoral condyle. Okay, and then and what we are seeing on MRI, the suppose on it is a T2 weighted image on the MRI. We see a lot of edema. We're seeing a lot of edema on the medial aspect. We see a lot of edema on the that's it. And this should be white in color. So we're seeing a lot of edema in the medial aspect. Okay, medial femoral condyle. And there is no history of trauma. There is no history of trauma. And this is the only history. So what is this condition? What is the spotter? This is a spotter. What is the diagnosis? Think about it. The answer I'll tell you in the next video. Okay.